Okay, so the initial are okay. Date is fine. Dear Dr. Hodges, there should be a comma over here. Mr. John Alucius, 33-year-old, fine. I'm writing to update you about Mr. Alucius, who has been treated for pulmonary tuberculosis. Your further follow-up and management would be highly appreciated. Fine. Finally written, no problem so far. Okay. On this day, Mr. Lucius presented for admission because he had symptoms of greasy stools with abdominal pain along with blistering rash over elbows, knees, and buttocks. He also reported weight loss of 2.5 kilogram and this. Okay, you don't need to write and over here with easy bruising. Please note that his vital signs were not significant. Fine. On subsequent visit, Mr. Lucius had come because he was suffering from night sweats and fever along with cough and hemoptysis. On examination, his oxygen saturation had been 92%. Or you can just write simply was. See, this was is more better here. Was 92% along with raised
Okay.
temperature and there were scattered rails on chest auscultation. Fine. Chest X-ray revealed apical infiltrate and therefore apical infiltrates. And therefore, a presumptive diagnosis of pulmonary tuberculosis was made. Fine, no problem. You can definitely write this thing the way you have written it. Okay, let's move to the next part. Okay. On this date, Mr. Lucius had been placed in isolation ward and his investigations on 03 indicated positive culture and acid fasting. Therefore, he was commenced on anti-tuberculous regime along with vitamin B6. His nursing management included a normal diet with weekly sputum tests and monitoring for side effects. Fine. Today, Mr. Lucius has been looking well, but complaint of, see, you can write today Mr. Lucius is improved or is looking well. Okay, that would,
Hmm.
okay,
Okay.
is improved, or you can write that Mr. Lucius has showed clinical improvement or significant improvement if you want to be more and more accurate. Okay?
Okay.
Then but complain of feeling lonely and depressed. Okay, so how you can improve this sentence? Today, Mr. Lucius has showed satisfactory clinical recovery. However, he feels or he is feeling depressed and lonely.
Yes. Got it.
Yeah, so that would be more better.
Okay.
Okay, so then let's see the next one. His test report shows a negative result, therefore he has been allowed to be discharged. His plan includes continuation of drug regime for the next 2 months, and then cease pyrazinamide and ethambutol, um, and continue isoniazid along with rifampicin for 4 months. His medication compliance will be monitored. Okay, his medication will
Mm.
compliance will be monitored. That's how you have to write. By dot, and periodic baseline tests and ishara tests will be done to discuss his side effects.
Assess.
Sorry, assess the side effects. Okay. Uh, let's see. Any of the above, I would be grateful if you could further assess and manage Mr. Lucy's condition accordingly. See, if I were you, how I would have written this particular thing and the lines, if you ask me. So, in this, just very quickly, let me summarize this particular visit for you. So, I would have written today. Today, Mr. Lucius has showed satisfactory clinical recovery. However, he complains of feeling lonely and depressed. His
Mm.
tests, or his recent tests are negative for, or test report shows a negative results. Therefore, he is getting discharged. Okay, his discharge plan includes continuation of 4 drug regime for 2 months, and cessation of ethambutol and pyrazinamide after 2 months. Okay. Now you can just summarize that. You can end this paragraph of yours here. Then what you can do, you can write, in view of the above, I would be grateful if you could further monitor the side effects of the medication and his medication compliance by dot and periodic baseline test and ishara test. Okay, so that would be more better, because this is something that you have to conclude with.
Okay.
Okay, this is how
Mm.
you can improve it. But the way you have written, that is also fine. I'm not saying this is not fine, but that is the more and more better
Mm.
way. Okay.